Let's talk now about some of the best practices that we see within the resource and infrastructure sectors. These are very challenging times for many of our clients, and I want to go through some of the key learnings that we've had throughout this crisis. The first is around traveller management. The resources sector is quite unique in the breadth of travel that is done and the type of countries in which you operate. So it's absolutely critical, therefore, for you to be monitoring this travel to see which disruptions might be occurring, where quarantine and visa restrictions might be occurring. And now more than ever is the time to have proactive communications to your travellers in the field. It's really important for you to monitor official travel recommendations and plan and anticipate reroutings and quarantine in foreign countries. Absolutely crucial is that you reiterate that nobody should be travelling when sick. The second area is around information and advice. And given the types of projects and remote areas that you are typically operating in, this is especially crucial. Both when they're on project and in their accommodation areas, it's important to have active health promotion on site so that they know what should and shouldn't be done at each point. When should they be isolating? What are the signs and symptoms? What does quarantine mean? All of these things can be done both in terms of toolbox talks or posters, and this should also be available in local language. It's really important for you to communicate actively and proactively on what prevention strategies you're putting in place for your workers, not just for the travellers, but for your local employees as well. Thirdly, and I think perhaps most critically for your sector, is plan and prepare for cases on site. We are involved in multiple cases that are presenting to remote project sites of confirmed or suspected COVID-19 cases. And you are uniquely positioned in the ability both to identify those cases and manage those well in the countries in which you operate in. More than any other sector, the resource and infrastructure sectors is familiar already with the concepts of medical emergency response planning, and many of you have already stood up infectious disease response plans. Now is the time to review those plans and ensure that they are accurate and relevant for COVID-19. To review those plans to make sure that you know in the countries in which you operate where you can diagnose and treat COVID-19. You are uniquely positioned in many regards in that many of your project sites will have medical staff on site. That means that you are able to educate and train those staff to make sure they're doing the most appropriate public health measures that are needed. And that will involve things like isolation, contact tracing, and helping the public health authorities to identify those who may be at risk and need to be isolated. Cleaning methods, stockpiling and using and training people how to use the appropriate personal protective equipment during this outbreak. Lastly, anticipate significant business disruption. Do make sure that as you review your business continuity plans that there is specific mention of infectious diseases such as COVID-19, because we know this is not going to be the only disease that we see in the future. Make sure that what you do now can help you in the future. As you develop your plans, identify your critical functions, your positions and backups. And we're starting now to talk about things like workplace zoning, to identify those areas that are particularly crucial to your operation where you might need to do some additional measures. You should identify in some of the countries that you're operating the very real risk that local authorities may decide to close your facility. So do review your health and safety procedures. Make sure that they're relevant. Make sure that you've reviewed your communication plans to your workers, to the markets, and to the local authorities so that you are prepared for this eventuality. Lastly, and most importantly, make sure that your health planning is integrated with local health authority requirements and that you are assisting the local health service to capacity build. This represents for you in the resource and infrastructure sectors an excellent opportunity to showcase your capabilities in this regard. As the crisis is evolving more and more, excellent information is becoming available. If you do require any additional advice or information, please do refer to our website on the screen.